Thank you. So yes, I'm Meg Hegarty. I'm the active program FitLine coordinator at Age and Opportunity. Next slide, please. So hopefully you may have heard of Age of Opportunity, but if not, Age and Opportunity is the national organisation working to enhance wellbeing for older people. And we do this through participation in sport and physical activity, arts and creative engagement, personal development, community collaboration, and active citizenship. Next slide, please. So obviously I'm going to focus on the active component today, but just to make you aware, we have 3 different programs. Our active program is designed to get us more active and to participate more in recreational sport and physical activity. But we also have an arts program, which provides opportunities for us to engage in arts, cultural activities and initiatives. And we have an Engage program, which offers courses and workshops, and they promote personal development, community collaboration and active citizenship. Next slide, please. So I'm part of the active team at Age and Opportunity, and Age and Opportunity Active is the national program for sport and physical activity for older people. And it's funded by Healthy Ireland, Sport Ireland and the HSE. And all our initiatives are designed to get people over the age of 50 to be more physically active. Next slide, please. I think Adrian pointed a lot to the benefits of why being physically active, but in summary, to maintain physical and mental health, and very important as we age, to continue with independence and quality of life. Regular physical activity helps prevent and manage chronic diseases like heart disease and diabetes, and improves strength, balance and coordination, which reduces the risks of falls, which can be very catastrophic in older age. And also being physically active enhances our brain health. Next slide, please. So why support? Why the focus on older people? So maybe the first point for that is that this stage of life represents an important period to promote physical activity to improve our functions of daily living, and also to slow progression of disease and disability. Next slide, please. Jacqueline referred to Irish population as being an aging population. So in Central Statistics Office measuring Ireland's progress in 2022, it was noted that the proportion of the population over the age of 45 has increased significantly. So in 2013, we had 35.4% of our population aged 45 or above. And in the 10 years leading to 2023, this increased to 40.6%. Next slide, please. So just relating back to the topic for the webinar and thinking about how our participants at FitLine relate to an online world. At Age and Opportunity, we carry out our own research, and our policy research and evaluation work underpins and supports our programs. So we carried out research in 2022. It's available on our website under our resources section. And it was research on digital access and older persons throughout Ireland, using PPI as a core principle. So specifically, we involved peer older people, researchers, in the design, implementation and analysis of the research. Next slide, please. So this shows self-reported skills in internet usage, and the Y, or the vertical axis, refers to the percentage of respondents, and along the X, or the horizontal axis, was how people rated their own internet skills, and that ranged from very good, good, okay, poor, very poor or non-existent. So overall, 42% of our respondents rated their computer skills as either being poor, very poor or non-existent. And further analysis of the data showed that the level of computer skills decreased by age group. So for example, by the time we got to people who were 80 years and above, 41% of those respondents rated their internet usage skills as non-existent. Next slide, please. I've taken this from Trinity College's Irish Longitudinal Study on Aging from 2020. And again, their research shows that home internet access decreases with age. So usage fairly high in the 50-69 age group, where 86% of people said they had access to the internet. This decreased to 66% once people reached the age of 70 to 79, and then reached the very low figure of 38% of people 80 and above saying that they had access to the internet. Next slide, please. So the recommendation really from our own research is that a significant proportion of respondents indicated that they simply do not want to engage in online services or connectivity. And interestingly, there are statistics about the high level of smartphone ownership in Ireland. But again, from my experience of older people through our initiatives, a lot of older people still predominantly use smartphones for, say, for example, telephone conversations and text. They don't always use the full functionality of a smartphone. So our recommendations from our research is that services should continue to ensure that other options are available to older people who are experiencing digital exclusion. And peer researchers indicated that the policy of pushing all services online is not a welcome age-friendly development among their peers. Next slide, please. Thank you. So our digital offering is available on our YouTube channel, and we created and uploaded movement minutes exercise videos. We have about 100 of those uploaded on our YouTube channel. They were uploaded during the time of the lockdowns during the pandemic. They're about 20 minutes long, and some of them are done seated, some of them are done standing, and they're all low impact and suitable for older people. Next slide, please. Adrian referred to guidelines on physical activity. So just to reference that, the National Physical Activity and Sedentary Behaviour Guidelines for Ireland from the Every Move Counts in 2024 are that all adults aged 18 and upwards, including age 65 plus, should be doing at least 150 minutes minimum of moderate intensity aerobic activity per week. And there's lots of examples of what could count as moderate activity, brisk walking, water aerobics, cycling, and so on. Next slide, please. And additionally, we should be doing muscle strength activities on 2 or more days a week. That could be in an organized class, such as yoga or Pilates. It might be part of everyday life at home, such as climbing stairs. Exercises using our own body weight. So a press up would be a good example. And again, there are modifications. So if somebody can't do a press up on full press up, you can do the press up with your knees on the ground, or if you can't exercise on a mat, you can do a press up using the wall. Cormac led us on the sit to stand or the chair rise, and that's a modification of a squat. So again, you can start with a sit to stand on a chair and then work up towards a squat. Another way of building muscular strength is using resistance bands, and again, that can be done seated or standing. And we've seen an increased use of free weights or dumbbells. Again, they're not necessarily available in sports shops. We have older people maybe coming across them in supermarkets and doing exercises like bicep curls or shoulder presses at home themselves. Next slide, please. So once we reach the age of 65, the recommendations are that we should be doing functional balance and strength training on 3 or more days a week to enhance strength capacity and prevent falls. So again, there are particular exercises that people can do at home, such as standing on 1 foot and counting how many seconds they can do that, and then alternating. And in terms of safety, people can do that maybe with their hands hovering over a very solid counter in maybe in their kitchen, or with a very sturdy chair nearby. Walking sideways is another way of building balance. And what we call tightrope walking or heel to toe walking. Another option, because some people do say that it's very difficult, they know they should be doing the exercises, but can be very difficult to motivate themselves to do that alone. A class or group for older adults is a good option for many, and also incorporates aerobic as well as balance and muscle strengthening activities. Next slide, please. And that's just the reference for the recommendations are available on the government website and also on the HSE website. Next slide, please. So in terms of the Irish context, and this is research from 2020, older adults are at particular risk of leading inactive lifestyles. So in Ireland, 55% of older adults aged 65 to 74 years, and this decreased to 37% for people aged 75 or over, report taking part in sufficient physical activity to meet established guidelines for health. Next slide, please. This was research, again, I found on the Central Statistics Office from July 2025. And this is the percentage of people that engage in selected physical activities for 3 days per week or more by age group. So the age groups we're particularly interested in is the green bars, which is 65 to 74, and the yellow bars, which is 75 years and over. So on the Y, or the vertical axis, we have the percentage of people, and the horizontal or x-axis is the types of activities that people were asked about. So the first category was whether people walk to and from places they need to go to on 3 days or more a week. And we can see that there was a very high percentage of people who use walking, and that was at least 60% for all groups. The second category, which is the lowest, was the percentage of people who use cycling 3 or more days a week to get to places they want to get to. The third category was people who do sports fitness or recreational physical activity on 3 days or more a week. And we can see that was a maximum of 50% for the younger age group, and that reduced to only 30% for people aged 75. And finally, the last category was how many people did muscle strengthening activities on 3 or more days a week. And the numbers there are very low. So people aged 75 and over was only about 11% of people who said they do that. And that would again tie in with our experience on the ground. There is maybe an exclusive focus sometimes on walking in Ireland and getting our steps in. And sometimes there's a lot of work to be done in terms of educating people and exploring with them how they can build muscle strengthening activities into daily life. Next slide, please. So what do we do in the active program to encourage people and give them opportunities to be more physically active? So we run an active national grant scheme in February every year, and that's where we give small grants to community organisations as long as they use it to buy equipment and run a physical activity for older members. We have FitLine that I'm going to zoom in on in a moment, which is telephone support to be more physically active. We have a PALS initiative, and that's our physical activity leaders, where again we teach people who come from local community groups like Men's Sheds, ICA and so on, active retirement groups, and they go back and lead their group in a physical activity. We run a Go for Life games, and we're piloting regional games this year where we bring people together from different counties to compete in adaptive games for older people. We run Try It activities every September as part of the European Week of Sport. We run a Sofa to Saddle initiative. And more recently, we've been running walking football initiatives. When we look at the figures for FitLine in a minute, we'll see that it has been much easier to engage women in our initiatives. I think the walking football has been something that's attracted a lot more men to become more physically active. And then walking football as medicine is something we've piloted this year. Next slide, please. So we've seen an increase in walking sports as an option for people over 50. And we piloted walking football as medicine in Cabra in Dublin this September. We ran a 5-week program. It's a fun, non-contact version of walking football, but it's designed specifically for adults living with chronic conditions or impairments. So, for example, we had people with Parkinson's, heart disease, and arthritis who took part. It's led by trained coaches. It improves fitness, balance, and coordination. And again, there's a social element. So we found that after the games, people were staying behind maybe for up to an hour and sharing their experience and interacting with the other members. We've learned a lot from the UK about walking football as medicine. It's very established over there. They actually started it over the pandemic online, and it's now kind of very popular in the UK. Next slide, please. So FitLine is the particular initiative that I lead on within the active team. And that is regular telephone calls to older people who want to start becoming more physically active or who move a little bit and want to move a bit more. And from working on the ground, we would very much echo those statistics about the focus on aerobic activity and maybe lack of awareness of the importance of specific activity to work on balance and on muscle strength activities. Next slide, please. So in terms of our figures for 2025 so far, we've supported 168 participants, 26% of which are male and 74% of which are female. Next slide, please. In terms of the age range, we have a handful of people in their 50s and also in their 90s, and the majority of people are in their 60s, 70s, and 80s. Next slide, please. So how we help people, it's telephone-based support. Volunteer mentors gently encourage and motivate participants to be more physically active. People who sign up to FitLine receive a call at an agreed time every 2 weeks. We set 6 monthly goals once somebody signs up. And then in the fortnightly calls, we set a SMART goal and review the goal from the previous time with the mentor's guidance. We do meet people where they are, and the majority of our participants are living with one or more chronic conditions. Next slide, please. We find, particularly for people that are not online, there can be a lack of knowledge about what's available or a lack of confidence about trying something new. So increasingly we see activities, physical activities for older people. Maybe you have to register on Eventbrite or you have to scan a QR code, and certainly a lot of our cohort on FitLine would struggle and sort of ring us for help with registering for events. Our FitLine mentors help our participants to get information on suitable physical activities, for example, walking groups, exercise classes for the over 50s, chair exercise classes, and yoga. So it has the added benefit of more connection socially. Some of our users are quite isolated. Next slide, please. Just a little bit about the roots of FitLine. So it's based on evidence-based active choices behavioral change model from Stanford University. And back in 2009, Age and Opportunity piloted FitLine on a small local level in Drogheda. And then thanks to funding from Sport Ireland, once the lockdowns happened in 2020, we rolled it out nationally. Next slide, please. It's completely free to refer to FitLine or to use FitLine as a participant, thanks to funding from Sport Ireland, Healthy Ireland, and the HSE. Next slide, please. So how to access FitLine? Anyone can refer themselves as long as they're aged 50 plus, they live in Ireland, they'd like a bit of support to be more physically active. We have a telephone number and an email address. A lot of people find out about us. I do local radio interviews. We take out ads in local newspapers, and we also put posters and flyers in libraries, and they're a very successful way to recruit participants. People can also be referred by professionals. So we get lots of referrals from social prescribers, community connectors, physiotherapists, and so on. And everyone who signs up to FitLine, as well as getting a mentor, also gets a booklet called Staying Strong and Active at Home that contains mobilizers and then 7 basic balance and strengthening exercises with photographs that people can try at home. Next slide, please. So we collect feedback from our participants. I think accountability is something we hear again and again. So Moira in Dublin said, if I'm inclined to get lazy, It encourages me because I want to be ready to tell her, that's her mentor, a whole lot of things that I've done. So I think particularly heading into the winter in Ireland, the days are getting shorter. It's kind of windy and rainy here in Sligo today. So we often hear from people that they look out, they were about to do their exercise and they kind of feel like they don't want to do it. But because they know their mentor is going to be calling either that week or next, that can sometimes give them the push to go ahead and be active. Next slide, please. We also get positive feedback from referrers. So the welcome approach from FitLine staff is particularly helpful when trying to engage individuals who are hesitant or reluctant to try new things. And using calls rather than online-based activities allows for more inclusive participation among those who are isolated with no digital access to internet or digital literacy. Next slide, please. Volunteer mentors in an online world. So we find that our mentors are partly drawn to the role because it is a remote role. They can make the phone calls from home. They are local people with an interest in sport or physical activity. They have an understanding of the challenges of being physically active. We do guard the vets, take reference checks, train and supervise our volunteers. And their role is to make calls from home every fortnight to the same list of participants. Next slide, please. We use motivational interviewing as a framework, and we cover that in our volunteer training. This is an evidence-based framework to help people to find their own motivation to change their behavior. It was developed by psychologists Miller and Rolnick in the 1980s. And for those of you maybe with knowledge of the different approaches in psychology, it would broadly fall under a humanistic approach. Next slide, please. We don't kind of come in and tell people what to do. So put simply, it involves coming alongside the person and helping them to say why and how they might change for themselves. So through our conversations, we try and evoke people's own reason for becoming more active and also identify ways that will fit into their routine, their particular health challenges, and also their preferences. Next slide, please. So kind of in summary, to link my presentation back to being active in an online world, we see engagement with our movement minutes videos on our YouTube channel, but it has reduced now that people can meet face to face. And following the recommendation from our own research, we will continue to prioritize in-person or telephone interactive engagement for older people. And we feel it's very important to continue to offer alternatives to online resources for those who, through lack of skills or access, or simply by preference, want to engage offline. Next slide, please. And these are just our contact details. There's a national free phone number. That's my direct work mobile. You can email FitLine directly. And if you'd like further information about Age and Opportunity in general, and you wanted to have a look at our Engage or our arts program, do have a look at our website, which is ageandopportunity.ie.